You're back at the Faculty Factory podcast, and I'm Kim Skarupski, talking to you from the University of Texas Medical Branch in Galveston, Texas, looking at my new friend, Dr. Ellen M. Friedman. Hi, Ellen.
Hey, it's good to see you.
She is a professor of otolaryngology and head and neck surgery at Baylor School of Medicine and the Senior Associate Dean of Professionalism and the Director for the Center of Professionalism at Baylor College of Medicine in Houston, Texas. Thank you so much for being here, Ellen. I've heard so many good things about you. I'm so excited about your topic today, promoting positive professionalism, or P cubed, as we're going to put it on the website. Go
I
ahead, Ellen. Thank you again, and tell us what is all about the Center for Professionalism and the work you're doing.
Thank you so much for this invitation. It's really fun to get to know you and to be here to talk about the center. The Center for Professionalism was begun in late 2013 at the request of Dr. Paul Klotman, who had recently come to Baylor at that time. And he gave us two missions. One was to elevate professionalism throughout the college and its campuses and its satellites, as well as to identify and remediate individuals with lapses in professionalism. And so those were our two missions. And it has been a really wonderful experience because it's been eye-opening. It's been new, interesting topics, and it's been very exhilarating because it really has been playing a positive role in creating a warm and positive professionalism climate here at Baylor College of Medicine.
Thanks, Ellen. Tell us about how do those mission areas, the goals get set? I guess I want to start backwards. Like, what is professionalism? Is this a national standard? And, did the president have this idea? Did you come up with it 12 years ago? How did you get these marching orders, and how did professionalism come about? Take us way back, in the Wayback Machine.
Yes. Well, I think that the idea came from Dr. Klotman, and the reason he brought this idea with him from his time at Beth Israel in New York City is that he had started a center there, and he was very pleased with the impact that it had. And so when he came here, believe it or not, it was one of his three requests that he would be able to start a center for professionalism. And the missions, actually, the two main missions did come from him as a mandate. And actually, we didn't get too many more directions. I didn't get too many more directions other than to try to put this in place. And so I was really able to sort of creatively approach the topic and learn a lot more about it and put programming in place. We also, shortly after starting the center, we did a needs survey of all of the clinical and basic science departments to see what they viewed as areas or gaps that the center could help with in terms of content for programming. And after getting the suggestions from as many individuals as responded to the survey, we developed other sort of subcategories of missions that would include education and training, building community, rewarding positive professionalism, creating accountability, scholarly activity, and teamwork, collaboration and teamwork. And under each of these categories, we developed a variety of programming and that were really open to the entire community. And we also have individualized programs that we set up for different departments, for example. And so some of the options that we have are grand rounds, workshops. We have interventions for civility projects where two programs that are working together frequently but have communication problems get to work out their issues together. We have communication course, conflict resolution courses, and it's really been quite broad and very rewarding. And we also, of course, have to deal with the remediation of individuals with perceived lapses in professionalism. And I'm proud of our efforts in that area because unlike some programs for remediation, this is really physician-led, and so it's colleague to colleague. And the initial approach is originated at Vanderbilt School of Medicine, and it involves the cup of coffee,
Cup of coffee.
right, which is really done all over the country. and we've Baylorized it a bit. We've, kind of tweaked it. And even though I think it isn't absolutely perfect, I mean, what in life is perfect, but I do believe that it sincerely tries to be understanding to the faculty member and supportive, transparent, and fair. So that effort has been really rewarding also.
Can you give us an example of how professionalism or lack thereof shows up with faculty and or with learners? So is this something that someone says, oh, Kim Skorupski kind of put her foot in it the other day. I really think she should meet with you, Ellen. Or is it, I was in a situation, Ellen, in a meeting, and I felt like there's something going on here. I'd like to talk about this. Or there's in my division or department, there's some kind of conflict happening and we need you to come and help us. Is it all of the above? Like how does professionalism look and how do you engage operationally with that?
Yes, well, it's all of that and more.
Mm.
Basically, we have an 800 number that you can call to make an anonymous report if you feel uncomfortable identifying yourself to make a referral. We do consultations, and I think that we get many referrals from HR or from chairmen of department. We've analyzed our cups of coffee, and we get them from a wide variety of individuals as well as anonymously. And we take every single concern and deal with it really in a very predictable pathway. And there is a pyramid of escalation. The initial interaction is called the cup of coffee, and it's a fairly informal conversation where we talk about what report was sent in. And so, we've all been around the block, and we know that the reports are not necessarily the truth, or they represent one individual's perspective, but we don't know really what happened. And that's how the conversation takes place, that we say we weren't there, we don't know the tone of voice, we don't know the context, but you were perceived as being unprofessional in this setting. And that isn't consistent with the atmosphere that we want at Baylor College of Medicine. And we thought that if you reflected on it, you may be able to think of ways that you could change your approach, change your communication style in order to give a more professional appearance in your interactions.
This is so fascinating to me for various reasons, and thank you for describing all of it. And kudos to Baylor for doing this for almost 13 years now. I'm thinking as you're describing this of the overlap with professionalism and wellness and faculty development, like leadership, because as you know, I love leadership and I love to come up with experiences and leadership boot camps and retreats and one-on-ones and all these things. And in much of our leadership curriculum, we include conflict mediation and difficult conversations and the crucial conversations. And we have that topic. We have communication in general, how to establish a leaderly presence. But I guess I've never really labeled it professionalism per se. And then as you're describing, so that's one overlap in terms of leadership. But then as you're describing all this rich content around civility and communication and conflict and all this, I'm also thinking of wellness. You're contributing to a wellness culture that at Baylor, you're kind of set by having this, you're setting a standard of a code of conduct. This is how we comport ourselves. We have these expectations or guidelines for behavior, and everybody signs in on it. And so I'm wondering if you could talk a little bit about the Venn diagramming, if you will, of professionalism with wellness and with leadership or faculty development writ large.
Yes, I think there's an enormous overlap, and I really love that you brought that up, because actually, when I think to the individuals who are referred for cups of coffee, who have perceived lapses in professionalism, I think that usually these individuals are stressed out. They are in difficult working situations. Um, I, they are burned out to some extent. They haven't had a recent vacation. And it isn't, some people view individuals with perceived lapses in professionalism as being jerks or, just bad actors. But the truth is that I have found that they many times are individuals who are completely committed to their patients, and situational distractors have just pushed them to the edge, and then they behave badly. And that's another element that I appreciate about our program, is that we recognize that wellness is a big part of it, and that it may not be that you aren't an empathetic or compassionate person. In fact, it could be that you could be empathetic and extremely compassionate, and it's the systematic or bureaucratic elements that really stymie you and make you behave or allow you to behave in a less than professional way. So
Mm.
I definitely think that professionalism, wellness, civility, all of those, I wrap all of them into professionalism. I personally think of professionalism as like a big tent. So many things are inside the big tent. It's really hard to draw the line where I'd say, oh, really, that's beyond professionalism. So,
Oh, Ellen, this is so smart. And I love how you have that insight into and that compassion for humans behaving badly, that it's not labeled bad guy, trouble, she's trouble. It could be, and it could be, again, the structure. It's the processes that are inefficient. We can imagine we all been there when we're just backed into a corner and we're at our wits' end, we're fried completely, and we just think, oh, for the love of Pete, why doesn't this XYZ work? Are you kidding me? As you said, I'm just trying to do the best thing for my patients, my learners, my colleagues, my research, my scholarship, and I continue to be thwarted by this fill in the blank nonsense. So I think it's really smart of us to make sure we are seeing the big picture, which again can overlap, as you're saying, with the organization. What if we're seeing, if I can imagine if you're having these cups of coffee and we think about the cases and we think, what is a common thread being pulled through here? Oh my goodness, if there are kind of flare ups in the OR, what's happening in the OR? It can't be that our physicians are all jerks. What is the problem here? Oh my goodness. Every time we've had a flare up, and I'm just pulling this as an example, um, it's because the inefficiencies in the turnover, or there aren't adequate staff to help prepare the rooms, and that leads to the schedule gets backed up, and the support staff, the nurses, they can't stay after hours. They have to leave, and you have a whole domino effect that this is all on the lead person in the OR. So of course they're going to lose it once in a while. So I love that sensibility that, yes, we each have a burden of knowing ourselves, to manage ourselves, and there's a structural, systematic component to, yes, and can we do something, please, about the fact that there's no toilet paper in the restroom? Whatever.
oh, I think you're right. I think that that's one of the frustrations with wellness programs. A lot of times they basically tell you to get more sleep or to eat more nutritiously, and they place a lot of the burden on the individual. When I think that there are many systematic issues and bureaucratic issues that really put people really in very difficult situations. And so, yeah, I think that that's an important and a positive element of our remediation programs.
Ellen, how do you orient your faculty at Baylor to the Center for Professionalism and the resources and programming and the expectations of them when they come on board and throughout the life of the career? How do you interface with faculty on a regular basis other than just being a 911 kind of a call?
Right, right. Well, we do have a presentation, a brief presentation that is included in the onboarding when new faculty and new hires come in, and it's a little bit of a generic invitation, but we have a very frequent announcements of activities. We have a really a very deep portfolio of activities that are invited to the entire membership, and this is advertised in many of the mailings that go to everyone. So they're very familiar with that, as well as we have a very active website that explains our purpose, it also offers our definition for professionalism and behavioral expectations. So people do get sort of oriented relatively quickly and consistently, because like I said, we have every, not, I wouldn't say every week, but several times a month, we have activities that are open to our community. So they kind of feel bombarded to some extent. And
Of course, email glut of emails, the bane of our existence. We hate it. It's a love-hate with our
right, right.
faculty, right? Stop emailing me. I'm like, well, then how do I tell you what we're doing if I can't email you?
Right, right. Or people who don't look at their emails and say, I didn't know about it. Well, we did send 4 emails. So
Oh
you
my gosh.
can't win, sometimes you just can't win. But
I think it's great, Dr. Friedman, how you have set up and established your Center for Professionalism in a way that doesn't have this feeling of being punitive or remediation. It's not like you're being sent to the principal's office. It sounds like this is something that you are proud of, that is a gift to faculty versus uh-oh, here comes the Center for Professionalism. Who did something bad? So again, kudos to you for setting this up to be a positive versus something that is uh, a stick.
I'd love to build on that just for a moment. Something that I'm really proud of with the center is that, in fact, our main focus, even though today we've been talking about remediation, is to acknowledge positive professionalism. And the truth in Baylor College of Medicine, but in all organizations, it's a very small number of individuals who are perceived to have professionalism lapses. And that's and unfortunately, that small group of people get an enormous amount of attention. And it's demoralizing to people who are following all the rules and doing a good job. So for that reason, we decided that it was really important for the center to honor individuals who do have exemplary professionalism. Now, obviously, Baylor did have an award already for professionalism, but it's given once a year. It's only through nominations by the chairs, and it's kind of a lifetime achievement award for senior faculty who have truly exemplary careers full of professionalism. This is an award that is given when anyone observes you doing something that they think is above the baseline. It's called the POP Award. It stands for the Power of Professionalism. And you have to write a paragraph to nominate someone who you've actually seen. I'm going to show you one of these awards that you've seen.
Oh, it's a big box, like a old-fashioned, old-timey box of popcorn.
Yes, and it comes with 2 movie tickets and a pop lapel pin that we ask that people wear with pride on their lapel. And we give the awards in front of as large an audience as possible. So it's usually at grand rounds.
Mhm.
And it has been truly embraced by everyone. It now is included on people's promotions packets. And one of the elements of the award that is particularly meaningful is that we read the nomination in front of the entire group. So when people are sitting there and they think, well, what is professionalism? Or, how does a regular person behave professionally? They hear an exact example of someone who is being awarded or acknowledged or validated for positive professionalism. And we have gotten such incredibly warm responses. I mean, when the award is given, the individual usually gets a standing ovation. Sometimes they come to the front of the room and they're crying. We've had individuals write and say, I'd love a copy of the nomination. I'd like to send it to my parents.
Oh,
It's really been very rewarding, and I love the idea of being able to shine a light on individuals with positive professionalism instead of over and over talking about individuals with lapses in professionalism, especially when they're in a very small minority of our population. And so based on that, that's one of the elements. We do a lot of things to reward positive professionalism. And some of my motivation in creating this award was coming from the Harvard Business Review, where it said one of the biggest deterrents of bad behavior is awarding good
good
behavior.
behavior.
And so, like you said, you reminded me when you said not the stick, we like to stick with the carrot. And so the POP Award is one manifestation of how we really put a big effort in that. And so this award is given every week. It depends on how many nominations we get. And we really enjoy giving them. And we enjoy the response of the individuals. And so it's been really, I think people overlook how important it is to be able to give positive feedback. And no matter where you are in the food chain, if you're a student or if you're a dean, it means a lot to recognize that individuals see what you're doing and they appreciate it. And so it's a token of appreciation from the school.
Good on you. Can you think of an example of uber professionalism? So recall the story, like what does that look like and sound like for the people listening to this podcast? What is someone who's got a professionalism award? What did they do that merited that kind of a nomination and an award?
Well, this is one that always sticks with me, and it's pretty extraordinary. But there was a medical student who was given an award because he was on rotation at our VA hospital, and one of his patients was terminally ill, and he was speaking to him, and the patient said he was ready to go, but he was very upset because he left his dog in his apartment when he came by ambulance to the hospital, and the student took his key and went and picked up the dog and brought the dog to a shelter. How
Oh,
kind-hearted is that? I mean,
oh my gosh.
wow, and that's kind of that seems somewhat like an extreme one, but honestly, we have so many stories of people who have gone. I mean, really, we're made up of an extraordinary community of individuals, and a lot of times we just act like it's expected behavior, and but people are doing really extraordinary things all the time, not always as heroic as rescuing this abandoned dog, but people are um, we had someone who there was a patient who was here from Afghanistan, and a resident got Afghani food and brought it to the
Oh,
patient. And,
oh my gosh. Oh,
and you can see why it's one of the greatest parts of our job, because,
oh
I
my
mean,
gosh.
to
I
be
would
able
love to. I just, oh, Ellen, I just got goosebumps. What a fantastic, we all need to do this. Everybody listening, we all need to do this because here at University of Texas Medical Branch, our provost, Dr. Susan Chubinskaya, when she came, she set up an annual awards, faculty awards and reception, and it's fantastic, top-notch food. Hundreds of faculty come and people get the award for mentoring and clinical mentoring and research and education and lifetime achievement and research education. But we don't talk about professionalism. And I can imagine a pin drop of people, their stories about humanity and just loving each other and taking that extra effort to see each other as human beings. I know that just when you see someone or interact with someone who is authentically, genuinely kind and caring, I kind of like, oh my goodness, like this is amazing. Feels so good. It's so heartwarming. It's the way things should be. And oh my gosh, Ellen, you've totally inspired me that we need that. We need that up the level of just kindness and civility, certainly now more than ever. I love it, Ellen. Oh my gosh, I'm so happy. First of all, I'm so sad about the dog. I can't get over it. I gotta get over it, gotta get over it. But I love the story of the food and just the little things in life that can just change someone's whole day and life.
There are so many stories, and there's stories. I think I told you two stories about people kind to patients, but we've had many about things that colleagues have done for each other that were not related to their salary or their job description, but where they come in to help someone where they had a sense that they might not have known how to handle a situation. I mean, honestly, they are very inspiring stories, and they are actually quite common. I mean, they actually happen with great frequency, and so I feel like we miss something when we don't really focus on it, and when we don't
Oh,
give it
yeah.
its due. So I love that you're enthusiastic about it, because
Oh my
honestly,
gosh, I'm so excited. I'm made a note that we're going to do that. Everybody out there, let's all do the power of professionalism. All give pop awards. You've just made my day. Oh,
and you know what we did? We also had an evening, and it was called 10 Talks, like not TED Talks, but 10 Talks, where we had 10 of the pop winners give a little talk about their thoughts on professionalism and kindness. And it had a reception, and we served popcorn, and everyone got to network, and it was really, really great. But listening to one after another, there were so many inspirational ones. One of them is a hospice physician, and she was talking about how when she walks into the hospital every day, she thinks to herself, what a privilege it is to help people on this transition. And I mean, I don't think there was a dry eye in the room, but honestly, all of our institutions have people who are so devoted, and I love looking for opportunities to highlight them. So I'm
Oh,
really glad you like the idea.
oh, thank you for celebrating the goodness and kindness. Dr. Ellen Friedman, Baylor College of Medicine, thank you for doing what you're doing, and thank you for being on the Faculty Factory podcast to share all this.
It was so much fun. Thanks for the invitation.
Thanks for tuning in to the Faculty Factory podcast. We are a faculty development community sharing tools to build academic leaders in healthcare. Maybe you want to be interviewed on the podcast? Please visit facultyfactory.org/contact and send me a message there. The Faculty Factory podcast and website is sponsored by the Office of Faculty Affairs at the University of Texas Medical Branch in Galveston, Texas.